And it's my job to introduce the panel, I believe, and I'm going to do it briefly. I think it's really going to be an interesting conversation. That's what I'm so happy about. I'm going to start with my friend, my colleague, a Western Mass leader, Dr. Frank Robinson. Anybody, well, throughout the state and especially in Western Mass knows Frank as a leader in health equity, in thinking through problems in really interesting and creative ways, and bringing our Western Mass community together because we're out there, okay? And we're not going to leave this side of the state alone, and Frank is a leader in that work, so I'm so glad Frank is here. I'm going to also mention, well, you've already heard from her, so I'm not going to go into great introduction. Oh, wait, that's not right. I'm in the wrong place. Oh, man. I'm going to welcome, I'm going to go from the local to the national and ask Denise Harlow to come up she's the Chief Executive Officer of the National Community Action Partnership. Denise is traveling around the country celebrating the 60th anniversary of Community Action, but she came up through the ranks and was the leader of the New York State Community Action organization like MassCap, understands deeply the challenges that people living with low incomes are facing, and has tried to lead us all in looking at creative ways to think about how to solve those problems. So welcome, Denise. And I was extremely distracted by the person outside the table, outside the window. Is anybody else distracted by them? And since we're all in human services, did anybody think they should go save the guy? Okay, wasn't just me, good. Juan Bonilla is here. He's the Vice President of Economic Inclusion and Wealth Building. Here from United Way of Mass Bay. And doing some real, I think I'm getting that right, Juan, you'll correct me if I'm wrong, and is taking some lead in thinking about how to think about the data and the story and what are we learning from what's going on out there. Has led things like the Building Credit Initiative, the Family Fund, and thinking about family opportunity centers, all the things that sort of intersect with what we do as community action agencies. So welcome to Juan. Now I'm going to ask Nancy Wegman to come up. Not Nancy, I'm sorry. See that? I would have prepared in the car, but I had to drive. So Georgia Katsoulomitis is here to speak. I think my staff will tell you, don't give me a microphone, okay? Georgia she's kind of the lawyer genius for us when we're thinking about questions on poverty in Massachusetts and what are some of the solutions to that, both on the legal level, but also understands the economics, all these kind of frameworks that we need. And she's been at MLRI for many, many years. She was also at the Fair Housing Center of Greater Boston for a while, has a broad portfolio of experience that's directly applicable to the work we do today. And I'm so happy to be on this panel with her. And finally, needing very little introduction in this room, but he's going to get one anyway, is Ed Augustus. And Ed is our new Undersecretary of Housing, who we're so happy to have here. And I met Ed, I think, back in the day when we were on the Mass Budget Board together and worked with Nancy Wegman. But he's been in municipal government, now he's in state government. He has a broad portfolio of thinking about, and actually he worked for the congressman as well. So he has the big picture in terms of where all the policy levers are to make a difference in our community. And right now he's focused like a laser on housing, and it's something that I think we're all so grateful for. So I'm glad you're here, Ed. So we had a discussion about what were some of the things we could think about and talk about here. And I'm curious if anybody has, to just start off, want to lead in with something that they may have heard during the presentation that they might want to think about. Like, we heard a lot about the war on poverty. And, Denise, you're at where the war was declared. Do you want to sort of talk to us about, what you see now with your national perspective?
Sure, 60 years, right, of fighting the war on poverty. And sometimes people will say, did we win the war on poverty? And many of you have heard me say this in the past, is that we win the war on poverty every day, one family at a time. Every family situation is unique and different. And we just heard today with Patty and Alicia, right? Interventions with one family have generational change. They ripple across. We win that war, again, for one family, one moment in time. And that work is so critically important. And hearing Elsie Gunderson this morning talk about shifting the framing from a war on poverty to a call to service, and is that not everyone in this room? Community action is amazing. We serve 99% of America's counties, 1,000 agencies. Heard the Reverend speak earlier. We have estimate 14,000 volunteer board members across this country fighting the war on poverty, answering that call to service every day. It is just amazing. I'll also echo one other thing that he talked about this morning was that everyone deserves a little bit of grace. And I hope that we're going to have some conversation here today that leans into that, because that is what community action does every day. It extends grace, it provides grace, and we've all been given grace ourselves.
Any other thoughts on that question? We had a little pre-meeting, and that engendered a lot of discussion. So I'm curious, Frank, if you have anything you want to say about that.
Well, is this here? Yeah. So let me come at it a little bit differently. The presentation this morning, Bradley's, was perfect, right on. 1964, I was a freshman in high school. Wow. And
okay, you're old.
Yeah, but it began this recounting of my journey through the experience of the CAP agencies. In 1966, 67, I was a member of the Neighborhood Youth Corps. I worked for the city of Springfield, and I didn't pick up trash. I was actually working from the engineering department. That's when I learned I didn't want to pick up trash. I wanted to be something more. So that was my introduction to CAP agencies as a youth in the Neighborhood Youth Corps. And since then, and I'll sort of dial forward some many years later, in my role at Bay State Health, I'm now retired. I was vice president for public health. And any time I had an essential public health related issue where I needed support and assistance, and I wanted to address social determinants of health with respect to folks most at risk of harm, neglect, had the highest rates of poor health outcomes, I would pick up the phone, I would call Clare Higgins, Paul Bailey, Stephen Huntley. They were always my first phone calls around an initiative because they were essentially at that intersection of those multiple resources needed to make people healthy or create healthier communities. So this conference this morning, I thought I was going to be presenting to like 30 people in a room. But this has been a renewing kind of experience. It says, yeah, I know now why I do what I do, and why I go to my CAP agency directors as my first point of entry into the work that I do as a public health professional. So that's my takeaway from the experience this morning.
I was struck that when we had a little pre-meeting, Georgia said something about, we were talking about poverty, and you said, yeah, we've invested a lot of money in it, but it's a policy choice. And so I'd love for you to expand on that a little bit.
Absolutely. First of all, thank you so much for inviting me to be here. Mass Law Reform Institute works very, very closely with basically everybody in this room. Our work focuses on systemic change and structural change starts from the ground up. So all of you are our partners in really trying to continue the war on poverty. I have a sign in my office that it hangs right behind my desk that says, "Poverty is a policy choice." And the reason I say that, and the reason we say that, and this is not something that's unique to mass law reform's philosophy, a lot of people have made that statement. And it's simply because we know exactly what needs to be done to solve poverty or to address poverty in America. We already know. I was telling somebody I think I was telling Denise at our table, if we all got together in the next 4 hours, we could come up with policy solutions that could address poverty. We know what needs to be done. Affordable housing, access to quality K through 12 education, a living wage, things like rent control. They can really put some parameters around the housing costs. And I know that the Executive Office of Housing and Livable Communities is working on a lot of initiatives, which I really applaud the administration on. But we know what works. And we certainly saw during the COVID pandemic, when there was, I'll just use one example, the expanded child tax credit. It dramatically decreased child poverty, actually to its lowest level that it's been. So why haven't we continued it? We know it works, so why have policymakers decided that, no, we don't want to invest in that anymore? So we are making an affirmative choice not to invest in programs that we know can lift people out of poverty. And the other thing I'll say to that, because there's a lot of discussion about moving people out of poverty, which is very important. I think most people with the right supports and the right investments can move out of poverty. But we also have to recognize there's a segment of the population, through no fault of their own, whether it is a health or a mental health challenge or some other reason, that they may not be able to move out of poverty. We have to make sure they live with dignity and have stable lives and are able to feed their children. So that's my long answer to your question. Yes, I do think poverty is a policy choice.
And I want to echo that, follow up on Georgia on those statements, because at the United Way, we have, as many of you know, gone through a dramatic shift in our approach to hopefully tackle systems change to achieve economic justice and equity. And this is the way I look at the problem. I've been in this work with all of you for over 20 years, and we all sit down and talk about, this individual in front of me is doing everything they possibly can and could do, yet there is something out there that is creating an insurmountable obstacle for them to achieve that stability and that progress. And I applaud those that make it. I'm one of those as well, who grew up poor, and here I am sitting in front of you with a good job, saving money, with a home, but not everyone achieves that path. And often I am, thinking about why does that exist? And I think we all, as much as, and it's commendable, the work that you all do every day, because you do see people every day who are suffering, who are struggling, who are stressed, who just need that hand up. At the same time, we have to change the structure. We have to focus on what it means to be human. What does it mean to take care of one another? And work on our policies and our, practices with those, those values in mind. Because I think then, when we talk about this program will cost X, we start thinking about what is the investment that it's going to take to bring people out of suffering into a position where they can take care of themselves and one another. And so I think we need to change the narratives that exist. That the research, I'll say this one thing and I'll pass it on, but the research that was presented when you saw the ups and downs, right? There were policy decisions behind all those ups and downs. And I think that I wholeheartedly agree with Georgia that, we have to reimagine, the work that we do here. We have to shoot big. I think not just lean in, but I think we have to go all in to solve the problem. And, we should not accept that here in the country, in the United States of America, that even 10% of the country is still living in poverty.
Thank you. And I think there's probably agreement in the room on the things that have been said. And the challenge is, how do we change those policies, right? And we're lucky to have the secretary here to talk a little bit about what kind of levers can we move in terms of housing? And I just want to, before you jump into that, Mr. Secretary, I'd just like to say that as I think about this from where I sit, starting as a child care worker in a community action agency, I care about stability for kids, because stable kids become stable adults who then are raising their own stable families, and we have instability for kids. That's also generational, right? And so as you're thinking about the big picture of housing in the Commonwealth, both the urban picture, the suburban picture, and the rural picture, what are you thinking about?
Well, I think there's evidence across the board of the housing crisis that we're in right now. Whether it be individual homelessness is up nearly 30%. The fastest growing part of that individual homeless increase are senior citizens. Think about that, folks in their 70s, 80s, who are finding themselves at that stage of life, housing insecure, living out of their car, ultimately ending up in shelter. That is, I think, a huge stain on our collective, record that has allowed to exist, and that's one of the reasons why the governor created a standalone housing secretariat to try to work with partners to address that lack of affordable housing, because that really is the driver of that, the lack of affordable housing. Something called naturally occurring affordable housing that's disappearing across the state rapidly. That's one of the reasons why in the Governor's Affordable Homes Act we have a transfer fee that's a local option, where we feel like if cities and towns would like to put 0.5%, 1%, or 2% surcharge on the transfer of property above $1 million, they could keep that money in their local community to build new affordable housing, maintain existing affordable housing, go in and maybe when a property is ready to change hands, help with a new roof and get affordability restrictions on that naturally occurring affordable housing, or investing in your local housing authority and be a partner with them to preserve that important safety net system. So the Affordable Homes Act, $4.1 billion. It's the biggest housing investment in the history of Massachusetts. 28 policy changes, everything from lowering the bar on inclusionary zoning from supermajority to simple majority, really doing some reforms around our public housing space, tripling the amount of dollars going into our public housing capital repairs. Massachusetts is the only state to have 43,000 units of state-owned public housing. There's 70,000 people who live in those 43,000 units. Those are seniors, folks with disabilities, families. Imagine where we would be, imagine where they would be if we didn't have those units of public housing. But to the point that was made earlier, that public housing should be safe and healthy and dignified, and too often it's not. We have not invested in the capital repairs, and certainly to meet our climate goals and decarbonize our public housing, this bill is going to triple the amount of dollars going into public housing capital repairs to make sure that important safety net part of our housing ecosystem is maintained. Because while we try to build more units and preserve more units, we cannot lose that 43,000 units, and that's a big part of the governor's bill. So there's so many pieces of it, and I'm sure we'll get into it in the course of the conversation, but when we think about our really vulnerable folks, I see that as kind of job one. Don't lose one of those units that we have online.
Yeah, thank you for that. And I think how many people, I expect the whole room has heard about this bill and has been thinking about how it would affect your own community. And that's one of the things I want to come back to, both for you and for everybody else. How do we, we think as a state and we govern as municipalities. We don't even have intermediary governance groups like counties in the Commonwealth of Massachusetts. I guess they were too crooked and we just ran them out of town. But it does mean that towns that are right next to each other don't necessarily think collaboratively about the housing or economic development needs. I'm just putting that out as an issue that depending on where you are, sometimes the only countywide or regional entity might even be the Community Action Agency, right? Or some of these mental health agencies or some others like that, as opposed to a government entity that is able to really pull everybody together and row in the same direction. So just a little marker there that looking at governance may be one of the things we have to do. And I'm struck by the push on governance from our friend from QCAP. It's true I think regionally too. So I want to go back though to the the issue the other issue is around two-generation approaches to helping people, right? So we had those wonderful folks up here where the mom and the daughter both benefited from that two-generation approach, right? And how do we build on that? That is dependent on housing stability to a certain extent. But how do we think about that some more? I know that nationally, Community Action has taken a role in thinking about two-generation. Yeah.
Well, and oftentimes we think of Head Start as kind of that original two-gen approach. We say it was the original two-gen. Today's whole family approach, because we recognize families living with low incomes often have more than two generations in a household. But it goes to, we can't keep siloing programs and services. And a lot of times these changes can be done in a regulatory manner, let alone statutorily, that agencies all across this room, you know how to navigate, whether it's HUD money, DOE money, HHS money, Head Start money, whatever it is. How many data systems do you even have? We don't want to even answer that question, do we? So when we put the family at the center of our work, which is what everybody has discovered we need to do, well, no, really? Community Action has known that for 60 years. We serve the family. To the family, the funding should be invisible. The policies and regulations around keeping ourselves healthy and living a life of dignity should be invisible. So when we think about a whole family approach, yes, it's about high quality early childhood education, and let's not get started on Head Start issues right now, right? Because we believe in Head Start. We believe in what children need to thrive. We need to focus on parents and guardians and grandparents and aunts and uncles and other adults in their lives to generate income, certainly. But we need to look at the whole family and all of the things that they need to live. Healthy food, to safe shelter and affordable shelter, but also connectivity to their community. The Urban Institute and the Gates Foundation a number of years ago did Mobility from Poverty. And they found, right, don't let zip code determine destiny, which goes to the social determinants of health. It talked about needing to raise income in a household, but it also talked about that social connectivity. And we heard from the two examples here about what they benefited from being part of Community Action. They were encouraged. They were given educational opportunities. They were supported to have a voice on policy council. Some people will say the Head Start is an early childhood education. Well, no, it's not. It is about empowering the parents as well. We oftentimes see the benefits to the parents outweighing even the benefits to a child getting ready for kindergarten, because it is focused on empowerment of family. And it's that connectivity that Community Action provides. You said it earlier, George, and we know what works. We were talking about well, maybe we'll get to this later, but just talking about what works, we were talking about the UBI programs, right? Universal Basic Income. That's cash into hands. It's the child tax credit. We know what works. Put cash in the hands of family. They'll buy food. They'll pay the rent. They'll get the car working. They'll get to work. They'll do all that stuff. You just got to have cash in hand. But what does every universal income pilot have to have with it? 40% of the money going to research. We have to stop trusting poor people. We have to start trusting poor people. We have to start trusting service providers to know what works and tear down these barriers so we're not dealing with 15 data collection systems. And no, I'm not exaggerating, am I? Really? You want us to serve the whole family? Let's tear down those pieces.
She has opinions about that issue. Do you? You're also saying something else there, which is, let's stop having pilots. And if it pilots and it works, let's do it. We're very bad at bringing things to scale, right?
I want to just follow up on something really important that Denise said, and it really gets lost in a lot of the public dialogue around public assistance programs. It is very important to put cash in people's hands, and we have found pilot after pilot after pilot that when you put cash in people's hands, where do they spend it? They spend it on rent, utilities, clothing for their children, school supplies. It is not spent on what certain politicians think it is spent on. For those of you who are not aware of why the child tax credit was not extended after it sunsetted after COVID, it is because Senator Manchin basically killed it. He basically was the nail in the coffin. And in private conversations, and there's a point why I'm relaying this story, in private conversations with people as to why he was opposed, he felt that putting money in people's hands, in poor people's hands, would result in parents buying drugs. This is not a joke. I wish I was joking. And my point to this is we have to stop looking at people who are struggling and who are low income as being somehow morally deficient, or they've done something wrong with their lives, or they're going to be spending money on things that are not appropriate. That has proven not to be true. Through the different UBI pilots that have happened across the country, there's one very, very important one that happened in Cambridge. Every single UBI pilot has demonstrated that if you put money in people's hands, they become more stable, their children are more stable, going back to the two-generation framework, and it only helps lift them out of poverty. Instead of jumping through 5,000 hoops in 5,000 lines in 5,000 different state agencies, filling 5,000 forms, and then recertifying over and over again to prove that, yes, they are in fact poor over and over again, every 30, 60, 90 days. If you just trust people to be able to know what is good for them and their families, they do the right thing. So we have to change the way, not us in this room, but we have to change the external dialogue of how some people in the general public view people that are living in poverty. And poverty is a function of unfortunate circumstances. It is not a moral failing. That's what it is.
I do want to make a point here. It is true that poverty is an issue of circumstances. It's also an issue of the fact that as of 1980, wages and productivity didn't track at the same level. Wages stayed flat while productivity went up. And across the United States, the minimum wage basically has been flat for many, many years. At least in Massachusetts, we've raised it, but it's not. Across the country, somebody living with a minimum wage job can't rent an apartment. So it is everybody, when they have small children, that's the poorest point in their life. So we just have to think about that. Like, what does that say if we're not willing to invest then? Like, right? Like, that's inventing in a growth stock, okay? Because that kid's going to grow. And if we do the right kind of investment, that's going to be a great investment. Right? So anyway, Frank is chomping at the bit, and I have a question for you. So
You saw me chomping, huh?
I did chomping. I could hear it.
Yeah. So I just wanted to go back to the two-gen comment you made. No, it's not true. Everybody doesn't get it. They don't get it. Now, you all live it. You get it. So Vice President of Bay State Health, we're doing a structural analysis of bias in policies. I cannot find one policy, this goes back a couple years now, I could not find one policy that favored parenting or caregiving employees at any level, low, moderate.
Wow.
No policies that specifically called out the unique needs of parenting and caregiving employees. Now, that was Bay State Health, largest health system in Western Mass, I think third largest in the state or whatever we are. Really progressive. But that lens just didn't fit. And as we explored other employers, it's non-existent. Parenting, caregiving employees just were not part of the fabric. I say that to say that there's a lot of work that can be done, needs to be done, and you probably are the greatest message carriers, great examples of two-gen families that actually have made a difference. So I think there's some untilled fields out there for that conversation. We recently submitted an application to EDA, Economic Development Agency. We're a recompete community, Springfield and Holyoke. We're 22 out of the nation, 8% chance of getting $20 million for 5 years. One of the things that we did was we built into our application a family prosperity network, specifically aimed at addressing the financial instability, obstacles, and barriers that face those chronically unemployed individuals. It's really part and parcel. So again, we're trying to bring a two-gen approach into how we redesign and develop a workforce development system in Springfield and Holyoke for specific targeted neighborhoods. Again, it was more receptive, but even with my partners, I had to continue to refresh them with the understanding that we have this chronic, persistent unemployment in these distressed communities because of financial instability. And unless we built into our workforce development system a 2-gen framework, childcare, the other kind of emergency supports and assistance, that we take on the issue of the benefits cliff, because a good number of the unemployed, chronically unemployed, are single-parent, female-headed households. And to take a job at Bay State as an entry-level position, they're going to lose money. So again, it's a policy fix that's bigger than the state. It's a federal fix that's needed. But again, I think this 2-gen perspective is really vital to addressing social determinants of health, and it's not a viewpoint that is widely accepted and understood.
You know, I'm looking at you, Mr. Secretary, because you know, we all know that housing is the giant problem on the table, but your portfolio as Secretary of Housing and Livable Communities includes some of these programs that help people stay stable, right? And most of them are funded almost entirely by the federal government. So we're at the kindness of strangers, as they say, right?
Yeah, and it's one of the things that quite honestly worries us as we're in election year, and the difference that one administration to the next administration has, and that yo-yo effect that we all experience when one administration is very invested in some of these programs and flexibilities, and another administration might think like, this is crazy that we're spending money in these areas. And that's, I think, in my 35-year career in different roles, has been one of the most frustrating things, is the yo-yo, depending on who's in power and, you know, what's in vogue and what's on their agenda. We do a lot, but we only do it for a short period of time, and so it doesn't get the traction that it needs, and the bigger impacts that, you know, we know it could have. And so I think, you know, I know we're focused on the policies and the funding, et cetera, but the politics is not unrelated to all of this. And I'm have to be careful I don't speak too much politics, but elections do matter. Who's in office and what their priorities are and what you can get done, if anything. And we see that in Washington right now. Even the most basic things can't get done. And that has a lot of impact on all the work that we do. And we're seeing it even with the Emergency Assistance Shelter Program, which falls under my secretariat. We've got 7,500 families in emergency assistance shelter. That's 25,000 people. That's bigger than half the cities and towns in Massachusetts, with close to 1,000 on the wait list. You know, with not a lot of partnership because of the dysfunction in Congress. So I think we need to be thinking about how we carry those messages and how we make those priorities known, and these are the years that that's important, because all the work we can do can only go so far if we don't have the right folks in the right spots.
You know, I'm looking at you and I'm thinking about the work that you have done and you've done, and you, I mean, this is an economic impairment. You know, we are compelled to solve this because we're losing population, we're losing young families, right? We are going to be in big trouble if we don't start solving this at the Commonwealth. Where's the business community on this? Where's the business community as they think about this challenge? Right, the United Way has always depended on the kindness of strangers, as they say, right? But those businesses are less and less likely to participate in United Ways, right?
Well, I mean, great point. I think when we talk about systems change, right, it's this, you know, very amorphous term, but, you know, when we're talking about the way we approach things, what we value, the approach, we see the work that we do with philanthropy and our donors as part of that systems change process. I think it happens at all levels. It's not just the state. We commend the state. I mean, they're leaning in. So we're lucky to be in a state like Massachusetts. You know, I have colleagues in other states where the problem is not even acknowledged. So I think, you know, there's a lot of work to do. But philanthropy as well, that, you know, part of our approach has been to start shifting, you know, the sector by us stepping in and taking action, and so our grants are now general operating support. Doesn't come with onerous reporting requirements. Our most recent selection of partners, notice I'm using the word partners. It's not grantees. That's intentional. We want to partner with all of you because you also are experts in this work. You are doing the work on the ground. We're not going to solve this by ourselves. So it is also about creating this ecosystem of, how can we work together? How do we break down these silos so that we can address these very, very big problems? With our donors, our private entities, we are seeing acknowledgement and recognition and there are folks who want to invest their dollars in the right strategy, in the right way. It takes time to inform, educate, and think about, we don't have all the answers, right? And so part of this is having conversations about what are some strategies that could ultimately create a better environment, a better ecosystem for some. And sometimes you don't have data in a specific way that can prove that cause, but there is data that we see all the time. And so we rely on that in educating and informing. But it's a lot of work. It's a lot of hard work. At the end of the day, what we hope in this journey is that the narratives that exist that we've all talked about today and more begin to shift, right? That we begin thinking about, all right, this is a problem that we can solve, and let's all come together and solve it.
But the other big spender, for want of a better word, is the healthcare world, right? And it's the last dollar is when crisis happens, right? Or, like we should be spending further upstream. That's the kind of work that you pioneered. Do you see opportunities there that may not be here, especially around partnering around housing?
Well, yes. So before I retired,
You're never going to retire, Frank.
I know, and even today. Okay. So I spent the last 4 years at Bay Street trying to get the organization to adopt anchor organization mission. That mission is very simple. We spend $1 billion a year. I said, give me 1% of that $1 billion. I don't want it as a grant. I want you to invest it in local surrounding neighborhoods, because where the institutions are existing, most of our anchors are in low-income neighborhoods. So give me 1% of that, make it an investment in those communities. Hire, source goods and services, make place-based investments. Do it in a way that is consistent with our strategic plan. Do it in a way that is a recurring investment year after year after year. It's not a 1 year, 2 year, 3 year community benefits grant that goes away, but it's how we do business as an organization. And so we've adopted that practice. And so our hiring is targeted to specific neighborhoods with very crisp and specific goals. Our sourcing, well, a little bit more difficult, but we're actually getting language in the contracts and redesigning so that we're purchasing locally. And so if we can set up an anchor organization mission and strategy where billions of dollars are spent every year, and those dollars are spent specifically in targeted neighborhoods on a recurring basis, not as grants, but as investments, we've begun to move the needle a little bit. Now imagine we get a half a dozen or 10 anchor organizations from the same community.
You mean community action agencies, of course,
Well,
when you say anchor agencies.
Well, I'm gonna come there. And
She's got to earn her money.
And I'm using anchor in the sense of those organizations those business organizations, Bay State, Big Y, Health New England,
Colleges and universities.
higher educations, those organizations that can actually make an immediate difference by changing organizational policy, by making local investments, and we don't have to wait for federal government or the, who's in, who's out. Not that we don't need it, but I think we can make substantial changes, create healthier places immediately by getting businesses to invest differently.
I think that's a yes and, because I think it's a yes and.
It
right?
is a yes and.
Yeah.
For 5 years, we've been involved with RISE on their social determinants of health national work, and we were a sponsor of their conference this past year with the Pennsylvania State Association for Community Action. We're thrilled that the health community has discovered that if you're hungry, you struggle with housing, you have poor water, poor nutrition, you're going to cost healthcare systems more. We need healthcare systems who are going down the SDOH route to stop creating for-profit institutions to do food boxes for diabetics. We know how to do food distribution. We need
Good
them to
point.
stop developing their own transportation systems because community action knows how to do transportation deep into local community in rural, urban, suburban, and frontier organizations. We're really concerned that new systems are being created when systems exist and have infrastructure and have sophistication and entrepreneurial. Community action, that's where the money is for our future, is in the healthcare systems. And we have CAP agencies around this country who have figured out the per member, per month fee structure, who've understood the contracting. These pieces, just like when we developed Head Start 60 years ago, when a peer organization knows how to do it, we teach another peer and another peer and another peer. We need to make sure we are those anchor institutions in communities to help reach in. We have the trust in our local, and I know you know that because you know Clare and you know our network. I just want to emphasize that in this space. SDOH, that's where the money is, and we have a role to play. We have to grasp at that piece.
And healthcare doesn't know how to do SDOH, social determinants of health. Now, I'm a public health professional in a healthcare organization. I don't look for internal solutions. All my solutions are external. My first phone calls are to Clare, Paul, Stephen, in order to get the work done. So we don't know how to do it, and we can't create it. We don't want to do it.
The other interesting idea that I think community action agencies do and are not at scale in a lot of places are financial opportunity centers, and thinking about financial opportunity centers in a different way too, right? Like, can we really bring them we do VITA, we do financial counseling, but boy, there's so much more room there.
Oh, absolutely. I would say if you have money, you go to an advisor to help you figure out where to put your money to grow. And those services are limited for people who don't have money, who need that guidance and support the most. It is a young industry, and I've been a financial coach myself and run programs in financial coaching. It's one thing to give people resources so that they can stabilize, but then people want to figure out how to then not rely on those services anymore and move ahead. We all want that, right? We all want dignity. We all want to self-sustain. And the Financial Opportunity Center model is trying to figure out how to serve individuals in helping them create pathways, right? Empowering them with the right information so that they can make informed choices on how to get ahead. It's not easy, right? I think this is what I mean. I've seen folks who have great credit, have stable jobs, have some money in the bank, and they're one emergency away from being back in line for a housing voucher. So it is a long-term process. It is this is why we have to look at our whole ecosystem to say how are families being sustained, not just in being stable, but then being able to thrive, move ahead, and then be resilient and secure. And I think that's the missing piece, I think, in what we've done over the last 200 years.
It's kind of interesting to hear the different point. Like, we know that housing absolutely needs a government intervention because the market has failed for most of us, right? Like, that's a place where government has a direct role in making a difference and has the ability to access some money to make the difference, right? So I don't know if you want to say anything more about how we can how we can partner on that, or.
Well, there's one new kind of tool that we're trying to add to our toolbox. We know in this high interest rate environment that there's a lot of affordable housing deals that just aren't working anymore.
Right.
They work in a 4% interest environment, not in a 7% interest environment. So in many cases, they've been permitted, they've been designed, but they're on the sidelines. And so people aren't building them, we're not getting the units online. So one of the things we've proposed in the Affordable Homes Act is something called the Momentum Fund, which we would seed with $50 million. And we would be looking for colleges that have endowments, that have real estate as part of their portfolio to put some money there, retirement funds to put some money there, foundations to put some money there. And we would still give them a return, but maybe the return is 4%, it's not 7%, but they get the other returns in a healthier ecosystem, easier access for their employees and the folks that they work with to have housing and take some of that pressure off. So we think that's kind of a unique tool that's responding to some of the challenges that we have right now. So we'll take an equity position, get a little less financial return, but still get a big community return.
That's a really interesting idea. We heard some of the the policy ideas like that we know work, right? The earned income tax credit. Looking at evictions differently, which we haven't really even talked about very much, but how do we think about evictions and eviction prevention in some different ways? I know you've been a strong proponent of trying to figure that out, Georgia, yeah?
Yes.
Yes. I'm looking at the notes and thinking, oh, there are some things that we know are like
Yeah.
short and some are long-term, right?
So, as I said, during the pandemic, there was an eviction moratorium, so people were stabilized to the extent possible. The moratorium ended, we've seen an increase in evictions. One of the big problems around the eviction process is that it is a completely unequal balance of power when you are facing an eviction. 90% of landlords go into housing court with counsel,
Right.
with a lawyer. And about 8 to 10% of tenants go into housing court with counsel. So that in and of itself creates a massive power imbalance. Basically, a tenant who goes into housing court, housing issues are very complicated. If, a person who goes into housing court who is facing eviction for non-payment or for other issues without a lawyer is basically walking into a trap. I hate to put it that way. Often there'll be negotiated agreements where the agreement is very harmful in the long term to the tenant, but it's like, this is the best I can do to stay in my home for a couple of months and then I'll work it out, and it doesn't end up working out. So what Mass Law Reform, with a very large coalition, has been pushing, and we really hope this will come to fruition this year, is we're pushing legislation to create a pilot project to create well, I'm not going to say right to counsel, it's access to counsel for people facing eviction and also for low-income landlords who are owner-occupants who are facing housing issues as well. But we think that that's going to make a tremendous difference. First of all, the playing field will be equal. So you will have both the tenants and the landlords represented. That creates a much more efficient process. And in fact, that's why there are actually developers and landlords who are part of our coalition, who see who understand why this would be important for all parties involved. It's much better for the judicial system because it creates efficiencies. And it prevents homelessness. It keeps people in their homes. A lawyer, first of all, knows any defenses that a tenant has that the tenant may not know and would not know unless they went to law school or consulted a lawyer. But it gives them an opportunity to work out a fair deal in order to stay housed. So yes, I think if we are able to pass this legislation and get it funded, I think that could really be a big sea change in other municipalities that have done this. And I think Massachusetts, if it does pass, we would be the first statewide access to counsel program. But in other municipalities, the other piece of this is if your landlord knows that you're going to have access to an attorney, he or she is more likely to treat you more fairly and try to work with you before it gets to the notice to quit stage. So yeah, the eviction issue is a serious one because once you're evicted, and especially if you're evicted from public housing, you can't even get into the EA shelter system if you're evicted from public housing. So evictions, it's a serious issue. And again, the power imbalance in the housing court is absolutely appalling, and it's not true justice. It's actually not true justice. So we're really hoping that this will move forward and pass and we can start to implement.
We had a pre-meeting, and that was one of the issues that came up, and I know for my staff, after the eviction moratorium ended, we were getting a lot of calls. And that's true, I think, across the state, so I'm glad you just mentioned that. I think it's an important piece for us to be thinking about. I hear what you're saying about also financial opportunity work, and this is a place, I think, where there's an overlap of what the work that the United Ways have done and others have done, and community action agencies. Many of us run VITA, many of us run financial stability programs. I hate to use the term financial counseling with low-income, people living with low incomes. They know they don't have money. It's not a surprise. The question is, what's available to me to help solve this problem or this puzzle, right? So I think there's a place where we have some room to work there. And I would put IDAs on the table as something we should be thinking about more, and I think we talked about that. And baby bonds, right. So, and baby bonds, I think the state is starting to work on, right?
You know, and I do want to say that, in our network, we have 7, CAP agencies, and
Right.
are also, some of them are FOCs. So there is, again, overlap, but I think there is a great opportunity at a CAP agency because there are programs that provide resources, there are programs that provide education,
That's right.
and then the one-on-one services. And so you're providing, if you can think of how to break the silos between programs and thinking about how to provide a holistic approach to the work, then you're going to identify the unique needs and challenges that each individual has and create a custom plan for them, right? There are folks who are going to live in perpetuity relying on public benefits,
That's right.
and that's okay. And I think that's the narrative change that I'm talking about, right? That, if you're on public benefits, then if you're receiving public benefits, then therefore you're lesser than. And I think we have to challenge that narrative. We also have to challenge the narrative that if people get resources, that they're needy, that they're lazy, that they're going to become lazy. So that's another narrative we have to challenge. We also have to challenge the narrative that all it takes is hard work, right? Lots of people, especially low-income families, are working extremely hard, multiple jobs, trying to keep their stability in the home, pay the bills, and stressing. Challenging their school system when they kick their kids out of school because they're stressed out about the stuff that's going on at home. So, it takes more than hard work. It takes opportunity, and it takes luck. It takes networks and resources. So I think that we have to challenge these narratives to say, let's take care, let's make sure the people are okay. Let's think of human beings, let's think of humanity first. And then from there, restructure all these policies that are in place and put in the new ones that we need.
You said something when we talked earlier that, during the pandemic, we actually started thinking about people and then what policies they needed, as opposed to policies and how do we fit the people into them. And I think you're right that we have to go back to that kind of thinking, right?
Can I add one more?
Yeah,
One quick thing about, is this on or off? My voice is loud enough, I don't even need a microphone. I'll say one more thing about changing the narrative. I don't know how many of you have read Matt Desmond's book, Poverty by America. If you haven't, I really do encourage you to read it, because I think he makes some really profound points and observations about how we can move forward as a nation. But he said something, towards the end that I wrote it down because this is something we really need to think about. We don't need to outsmart this problem, meaning poverty. We need to out-hate it. And what he meant by that, and what I mean by that, is we have to start changing the narrative that poverty is acceptable in society. We have to start looking at it as an embarrassment to society, not to the people who are living in poverty, but to all of us. We have to really start to view poverty as a collective problem, not a problem that impacts a certain number of people, but a problem that impacts all of us, because it in fact does impact all of us. One way or the other,
That's right.
it impacts all of us. So I think changing that narrative, becoming poverty abolitionists, which is, again, it's Matt Desmond's term, but I've adopted it as how I view myself. I think the policies and the programs that have been in place during the war on poverty have done a tremendous job in trying to keep people from abject poverty, but we're kind of sustaining poverty in a way. We're not thinking through, we've talked about some innovative things we can do, but we need to start thinking through how do we really address poverty at its roots? How do we abolish it? How do we start to think of poverty as a national embarrassment versus something that happens to certain people? And I think that's where we have to shift our mindset, and we have to shift the external narrative. That we have to start viewing it as we need to abolish poverty in America because it is wrong. Much like racism is wrong, much like all the other isms and all the other notions that we have that certain people are less than others, we have to view poverty as a moral wrong. And we have to take steps to address it on the policy front, on the human front, on the community front. So I just wanted to say that's another narrative that we have to kind of shift in ourselves, and more importantly out there and with policymakers.
thank you. Yeah, I appreciate that you said that. And Matthew Desmond is a really important voice in our work, and it'd be really great to have a community action reads Matthew Desmond, because his book is really important as we reshape our thinking about poverty. I'm going to give a couple other people one more last bite at the apple here, because we're coming up to our time. Yeah.
Okay, I'll just assume that everyone in here is registered to vote. And if you're not, register now. And vote. And vote. And I love the Matthew Desmond book. We keep trying to get him at our conferences, and he continues to be unavailable, but we'll keep trying. And National Book Club on it, I think would be fantastic. Brian Stevenson's quote from Equal Justice Initiative, the opposite of poverty isn't wealth, the opposite of poverty is justice. And I know our morning speaker also spoke to that concept and theme. We know what works. We know cash in pocket matters to families. We know the fallacy of TANF in our country. I haven't even touched on that today. We have to trust people, that people are human beings. And we have to fight for justice. And that's what everyone in this room is. You are a warrior for justice, and never forget it.
Frank, I'm going to leave you, and then I got a quote to close us with. So.
Yeah, well, in my retirement, I've said that 3 times now. I just want people to know that. So, I mean, I'm not sure I have much to add, except this gets played out in multiple levels. And in my career, I opted to be local. I figured if I could create a measurably healthier community in Springfield, and if I could do that by moving the levers of power, whether it's a Bay State or some other organization, to get them to adopt my view of the world, and that is that they need to invest in creating healthier places. Again, that's my public health agenda. If I can do that at a local level, then maybe I could do that at a regional level. So before I stepped away, I formed the Alliance for Digital Equity in Western Mass. Is it possible that you can get urban and rural communities to work together on the same program? Now, I was an adherent to the fact that all coalitions are local. You couldn't do that. Well, we did it. So we had the Alliance for Digital Equity in Western Mass. Again, it's a different way of mobilizing resources. Collectively, our voice is far more powerful when we talk about digital equity now than it was if it was a Springfield project. So I'm just wondering, are there regional, in place of counties, are there regional partnerships that could be formed? So in my partnership, I have CAP agencies, and there are higher education institutions, and there are private businesses, and we're all working towards delivering health equity, I should say digital equity, to all folks. Well, couldn't we actually take that winning formula, assuming it's a winning formula, and apply it to other issues? So organizations like Bay State or higher education or Big Y, they take 2% of their equity and they do long-term, low-interest, patient capital investments in building housing or in building preschool programs. Again, it's local, it's within grasp because we're in the room already now talking about it. It's just pulling the trigger to make it happen. So then maybe Springfield and Holyoke become the healthiest places in Massachusetts because we've mobilized all of those collective billions of dollars of resources because we've changed the way people think about the problem. We've redefined poverty. Perhaps maybe that's the hook I need to sort of bring people along. But I think we are on the verge of doing something, but I'm just not quite sure what the it is yet. I know we're close to something.
We're in this strange time of waiting, too, just to reference that there's this national election happening, and lots going on. So it does feel like we're in this pending time, right, where some choices will become clear. I just want to close this out with a couple thoughts. First of all, we didn't really take on, and I would be remiss as a person from Western Mass to say, the east-west divide in Massachusetts, where population is dropping in the 4 western counties. If it continues to drop in that way, we're going to lose yet another congressperson, which will even reduce our voice further in Congress. There's a need to invest in Western Massachusetts in order for the entire state to be stronger. So I need to say that, and I need everybody to hear it. Right? BCAC's in the house too, don't forget. Berkshire County. And the challenges across the state have the same top-level titles, but they're not the same depending where you are. So we just need to be cognizant of those differences as well, which means that the investments might need to look differently. But the other thing that, I was doing some research about the history of the war on poverty and thinking about in preparation for this panel, and I found this quote that seemed fitting for today from Sergeant Shriver, and he said this in 1964. He said, "Look at your own community, look at your own doorstep. There's poverty, there's a challenge, and there's a call to service if you will respond. Nobody can make you heed that call. That response must come from your own free will." Everybody here, you're here because you heeded the call and you came from your own free will. You're my heroes in this whole thing because you show up every day and take it on. So thank you to all of you. Did you ever hear that quote before?